Hello. Today is Monday, the 16th, and yesterday, the 15th, Sunday, we had 9,000, almost 8,395, but 9,000 cases of COVID positive tested in New Jersey alone. 25 people are diagnosed every 2 seconds now in the United States. So by the time I'm done with this message to you, there will be an additional 12,500 people who have tested positive. This is a crisis. We learned a lot of lessons in March. We learned about the disease, we learned about what to do, we learned about different treatment modalities, and science has continued to move through very, very quickly to ensure that we shared this information among all of the medical experts. So when this time came again and the virus hadn't been fully contained, we would be better prepared. So all hospitals have at least 90 days of PPE on hand. At Inspira, we have driven that very clearly, and we've rented storage units, and we have all the things that we could possibly need for our teams to make sure that. Here's what we don't have. We don't have an unlimited supply of staff to be able to care for everyone if indeed people continue to get sick at the rate they do. This is a virus that we can control by the things that we know. Hand washing, making sure that we're socially distancing, making sure that we're wearing our masks, being absolutely vigilant about all of those things as we were in the spring, which is what made the virus stop. Now I want to talk a little bit about things that Inspira has done, some of which we talked about before, but just as a reminder to make sure that you can navigate this journey. First of all, our urgent care centers have availability of the rapid test, but let me be clear. The rapid test really isn't any good if you think that you actually contracted it from somebody yesterday. There's an incubation period. It sits for 5 to 7 days. Having a rapid test on day one only makes you able to sleep at night, but you could still get sick. Wait those 5 to 7 days for the test, because that will indeed tell you whether or not you're positive. If by chance you do indeed contract COVID, we have a home program. This will monitor you to make sure that if you don't need to be in the hospital, you don't need to stay in the hospital. We'll monitor your pulse ox, which is a thing that makes sure we're watching your blood oxygen level. We have nurses who are checking in on you 24/7. We have the ability to ensure that the doctor has access to you and has access to computers that will follow you. All of those things to provide you the assurance that you can indeed stay where you want to be, and we indeed can see the sicker patients as they do come in. And as always, I really love to tell you the stories that happen, because the real life stories are what matter. And this real life story today actually creates a great opportunity for all of us in South Jersey. Dr. Scott Dawson became a champion for us and the COVID experience. And he became a principal investigator that allowed our site in Mullica Hill to be one of 10 worldwide sites to test the monoclonal antibody trial. This will give us access in our own home community to the latest vaccines, to the latest treatment modalities, anything that could be possibly needed to be tested. Scott is absolutely engaged in that process. And you know why he's engaged in that process? Because he saw it up close. His stepfather contracted COVID at the end of March. He spent 38 days in our hospital in Mullica Hill on a ventilator. Now, Leroy New was a lucky one. He was able to go to rehab, and he's home with his wife, and again, beginning to regain his strength and be able to get back to normal. But there's nothing like seeing it up close and making it happen with a loved one to make you absolutely invested that you don't want that to happen to anyone else. Wash your hands, wear your mask, stay socially distanced. We will get through this, but it will take every single one of us doing our absolute best. And unfortunately, I know you don't want to hear this, but it means Thanksgiving and Hanukkah and Christmas need to be different. I know it's hard. I know it feels like this is never going to end, but it will. There is lots of hope on the future. We're talking about vaccines, not even one vaccine, but multiple vaccines. We're seeing every single day brightness in this path. We just have to get through. So I'm begging you, wash your hands, wear your masks, Stay safe, stay socially distanced. There will be a time when we will be together again, but until then, be safe and stay well. Thank you.